On today's menu, a large piece of skin that I'll carve from your body. It's paired beautifully with a bold tannic merlot.
You saw me in your dreams.
Oh, yeah.
Boom.
Okay, stop. She's flirting. I'm telling you
anxious.
right now, she's
No,
flirting.
I'm not.
Yes, you are.
I am not a flirt.
I know flirting when I see it. She's definitely flirting.
Definitely flirting.
Norwood, give us a little timeline of when all this started.
In my brain, I thought my nose was too long. So in my brain, I wanted the nose shorter.
Over $100,000
Hey,
in
stop it.
surgeries to cut up his face, who was already perfect and beautiful.
Anyway,
Not as cute as you, but.
Almost every girl that comes in who's single, hits on Paul, there's something in the air in this office that's clouding their judgment.
I'm having issues with breathing and singing.
You're limited with your singing?
Very limited with my singing. The tone or the quality of my voice hasn't changed at all. But the ability to present those notes, it's very, very difficult.
Are you working on something now?
Yes, I am. And the producer I'm working with suggested that I wait until after my surgery.
Really?
To record.
So this is really inhibiting your ability to
Can we
make
hear a little bit of
Yeah,
that?
can we have a little sample?
She wants to have flowers just because.
Can you hear it?
Yeah. I hear a little bit of nasal, hypernasal, but also at the same point, I don't hear a lot of volume, pitch. I feel like it's constricted. What we have to do now is go in the exam room. I have to physically touch your nose and look inside your nose.
So you want to physically touch his nose as opposed to visually touch it.
Shut up. Can you please send in Keith?
Hey guys, how are you?
Keith, look at it. I love this outfit.
Thank you. I'm actually intimidated by Dr. Nassif and Dr. Dubrow because of what they do for a living. They repair scars, and me, I want scars there, but it doesn't hurt to ask.
I have to hear how you guys met.
We actually met at the Georgia Aquarium. We both worked there.
Did you two look like this? Did you?
Well,
were
I had a
you-
little bit. I had like a,
He
a
had a
couple
little
of pieces
tattoos.
here and there, but
Not
the
much.
face, the eyes, the head, no. Just, I always had the fascination for tattoos, and I just kept quiet about it because of how I will be perceived as. And as I got older, I was like, you know what? I'm just gonna just jump ship and just do what it is that I want to do.
As you sit here right now, I think what you've done in your pictures are pretty amazing, but I'll be honest, the eyes freak me out
Yeah.
a little bit. Are those real, or is those contacts?
Oh, no injections. I got them out done Brazil.
Yeah.
Oh, in Brazil. That's why I said what country.
That's for all the crazy,
Yeah.
When I first got my eyeball tattoos, I was a little nervous. Definitely blindness and infections did cross the mind, but at the end of the day, I wanted it so bad, and I love it to this day.
I was looking at your photo, especially the eyes. I did not expect very engaging, big giant smile on your face.
Yeah.
It kind of, it's intimidating.
It kind of
looking at
surprises
this.
people. I like tricking people.
But Keith, the smile ruins it. Have you ever thought of like staining your teeth?
No, I'm gonna keep these. I'm gonna keep
them
these
away.
white.
It started out with tattooing.
Yes. It progressed into piercings, and then I started getting into my scarification.
Scarification?
Yes.
We saw some scars in your photos, especially ran through here.
Yeah,
and the
around
cheek,
here, yeah.
But we didn't know what that was.
Yeah,
So
scarification.
scarification.
Yes.
So they cut out a wedge of tissue.
Definitely.
To create the
yeah.
scar.
Yeah, so the crazy part is most of the people that I know eat their skin. So they'll carve it out and swallow it and chew it up.
Okay.
On today's menu, a large piece of skin that I'll carve from your body. It's paired beautifully with a bold tannic merlot. What are you here for then?
I'm here to know how I could make my scars rise a little more on my face.
For him to do scars and having them heal so perfectly was the direction that opposite of where he was trying to go. He wants something that's a little more defined, that can be more noticeable.
More prominent.
Hypertrophic scars.
Yes.
Thick scars.
I want them, yeah. I also want to I want to remove my nipples and my belly button.
What about sensitivity? The two of you.
What do you like when Brittany?
Either you can play with them or maybe can suck them. Or
Yeah, no,
kind of like
not
it.
in.
There's certain things.
Yeah, not in that thing. By the way, right now I'm so fat and big, huge. It's disgusting.
So what are you saying?
Why?
Why?
For my torso area, more design. And I plan on doing more tattoo cover-ups and just to be artful, you know.
Interesting.
I feel it's more play field for putting on more art.
So wait a minute, Leslie, so you support that?
I support him.
You know, it's funny. So I remember when breast implants came out in the beginning and plastic surgeons thought it was crazy. And then it became instantly accepted. It's just another variation
But what
on body
happened to those doctors in the beginning that actually started doing breast implants. What happened to them?
They got an HBO special. I can remember my mentor. I remember the day liposuction was a thing. And he said, he was a professor at UCLA, that is the most ridiculous thing ever. And it's become like the number one.
Yeah.
So maybe this is a natural progression
Oh, yeah.
You
of
think so?
modification.
Can you please send a Monica?
Monica.
Nice to meet you.
Nice to meet you. Hello, I'm Anna.
Anna.
So, welcome. Let me ask you, what do you do for a living?
I'm an attorney.
An attorney?
Yeah.
What kind of law do you practice?
Family law.
So not medical malpractice?
No.
Okay, good. Welcome.
But family law, all the divorce stuff.
Yes.
Monica does not have the typical appearance of a family law attorney. And believe me, I know what family law attorneys look like.
So you have an interesting kind of look. What is your background?
So I go by like the Chi-Italian doll. I'm half Chinese and half Italian.
Chi-Italian.
Chi-Italian, I know.
By the way, Chinese and Italian, two of the best cuisines in history. I can't
It
even
all goes
imagine.
back to food again.
Yes.
Oh, yeah. You obviously, just based on the pictures, you've had some things done in the
Yes.
past.
At 11 years old, I started stuffing my bra. I just really like that look. I love like the big small waist, and I got my first job at 19.
All right.
Yeah.
What size put in initially?
350s.
All right.
Yeah, a D.
That's a
And
good size.
No, not to me.
Not for her.
Oh, really?
No, I'm pretty extreme. I went in with expectations of huge. I was young. I didn't really know anything about plastic surgery. I was pretty extreme, like going boom, 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 nonstop, like with surgeries. And so I have had 6 jobs, putting me up to like 1,400 cc's. I woke up, I was like, man, this is what I've always wanted. After I started recovering, I started noticing like my nipples were more inwards as opposed to center of the breast. And I had
Okay.
a lot of side. I like side. I just want my nipples to be more centered.
What were your breasts like before you had that? Were your areolas small?
Yeah, I mean, my areolas are the same size as they are now.
They haven't stretched at all.
They haven't stretched, no.
Normally, when you expand breast tissue a lot, the areolas expand with it proportionally. But sometimes there's a difference between the amount of elastic fibers within the areola and the immediately adjacent skin. So the skin stretches much more than the areola does.
I just always strive for perfection, so I just keep, you know, I see something, I want to get it fixed.
What do you think?
She's a little extra.
Extra is a good word.
We'd love to hear your story about your chin and your neck.
Okay, so I went in to the doctor. He looked at my chin area, and there was like a double chin and some loose skin. So he said that I should put an implant and I should get some liposuction around my face and stuff.
What kind of doctor was he?
He is a board-certified plastic surgeon.
Okay.
Yeah. 2 days after, he took the bandage off to see, and immediately there was like a little lump here, and then there was a ball here, and he said that this was scar tissue, and this, he wasn't sure what this was.
Scar tissue
After 2
immediately
days.
after surgery? Scar tissue does not form that quickly after surgery. If Michelle had a wound problem, it was because the surgical procedure reduced the blood supply to the overlying soft tissue and caused the tissue to die.
How's the feeling around here?
This side is always a little bit tender, and that's where he said the scar tissue was. He cut it out. That's why I have a scar going all the way up.
He cut on the outside of your neck? This was the wrong procedure, the wrong approach, the wrong everything to do to Michelle. You don't put scars on the outside of the face.
That's not the worst part.
Uh-oh.
On my last post-op, my appointment was really early in the morning, and I was waiting in the parking lot in the back, and there's this minivan that pulls up right next to me. This guy opens the door, falls out, and crawls over and starts pulling on my handle, and I notice that it's my doctor.
Wait a minute, hold on. Okay, wait a minute.
Your
Doesn't make
doctor's a
sense.
drug addict.
I rolled the window down and was like, do you need something? He's all, let me in. And I was like,
Let me in.
and I said, and then he's like, just come inside, just come inside. He doesn't have shoes on. His hair is a mess. And
Pulled an all-nighter.
we get in the facility and he's like, help me get one of his white jackets.
There's no one in his office to help him? It's just the two of you alone?
Just the two of us, but then the staff started coming in. He says, never speak a word of this. And I said, okay.
Oh, boy.
The doctor-patient relationship is one of the most sacred relationships in any profession. And When a doctor tells you, don't tell this to anybody, you understand because of the basic power structure between the doctor and the patient why Michelle didn't run out the door screaming. Our next patient is Rhonda. Rhonda has had a gastric bypass, and she lost 165 pounds.
Congratulations to her.
Yeah, she had a lot of loose skin and had some body lifts that just didn't go well. Oh, here we go.
Oh.
This was, it's not a good result.
Doctors, this is your next patient, Rhonda and Reggie.
Hi, Rhonda.
Hey.
How are you? Terry Dubrow.
Oh, it is so nice to meet
Nice to
you.
meet you.
How are
What an
you?
accent. I love that accent.
Well, thank
How are
you.
you?
It makes me
How are you?
friendly.
Terry Dubrow, nice to meet you. Have a seat.
You know, everybody's always said you sound like Dolly. Your personality's like Dolly.
Yeah, you kind of look like Doll. I could see that.
Oh, well, honey, you ought to see me when I bought a big wig and then I put the big girls on, you know,
Yeah.
and do the makeup up and tape up and
With
strap
all the
in
loose
and
skin.
stuff. Yeah,
You know what I'm amazed about?
what?
I can't see you weighing 165 pounds more than this. I can't see you.
It was a whole person.
If she can lose all this weight and get in shape, I think you can too. I really do.
could do it.
I think it should inspire you to do something.
Okay, but I'm not overweight,
Yeah.
so he's just saying that.
Do you go up and down? Do you have issues?
Well, he's obviously
No, I
up
don't.
right now. But let me ask you a question. So what prompted you to end up having the body surgery?
That was gonna finish what I started. I was really excited. And I went, and the problem was this guy was a guy, not a butt guy. He was a breast specialist.
Any doctor is allowed to do plastic surgery in a surgery center if they can get privileges. You can be a radiologist, you can be a rheumatologist and do plastic surgery, and it's legal, but it's just not a good idea.
I was his first case.
Oh.
Yes.
Did you know that? Did he tell
No.
you? He didn't tell you his first
No,
case?
no. And when I woke up from surgery and threw them covers back, I knew it was not right.
Oh, really?
It's like he pulled everything up instead of pulling it down and cutting it off. My belly button's between my my butt. You know, you want little honey buns, but I got a flapjack.
Right.
But he flat out told me, he said, look, this was over my head. This is the best result that you can expect. Even though I was devastated, I made a decision that I was gonna work on who I was on the inside and I could hide the outside.
What's the number one thing that's sort of bothering you about the result that you got?
The whole thing. We just need to hang me upside down and just, you know, cut everything off that's
Right.
hanging down.